2, 3. Let's go. Arise, O compatriot, Nigerians call, obey, to serve our fatherland with love and strength and faith. The labor of our heroes past shall never be in vain. To serve with heart and mind, one nation bound with freedom, peace and unity. Thank you very much. You can have your seat.
Thank you, Chooks. Good morning once again, and I would like to apologize that we're starting a bit behind schedule. The Honorable Minister of State for Health, Dr. Osagi Ehanire, the President Global Business Coalition on Health, Ms. Nancy Widefield, the Special Technical Advisor to the Minister of State for Health, Dr. Shoaib Belgar, the CEO, Aliko Dangote Foundation, Mrs. Zura Yusufu, representatives of various corporate organizations, CAMA members here present, members of the National Malaria Elimination Program, gentlemen of the press, ladies and gentlemen, I would like to say a very big good morning and welcome to this private sector session that is focused on accelerating investment to bring malaria to zero. Defeating malaria is absolutely critical to ending poverty, improving the health of millions, and enabling future generations to reach their full potential. According to WHO World Malaria Report 2017, which I find very interesting, and the key partnership frameworks that we need to establish in order to improve public-private sector partnerships. The discussions and activities of today, I hope, will truly shape strategies and actions that will drive increased impact and accelerate progress in the national efforts to eliminate malaria in as we work together, sharing best practice and strategizing on how to create new partnerships and record progress in our malaria control efforts across Africa, I can only wish us the best. Thank you, and I wish us a productive session ahead. God bless you.
Thank you so very much. Good morning, Honorable Minister, ladies and gentlemen, friends, and dear colleagues. I'm honored to speak to you today on the occasion of the CAMA Private Sector Malaria Forum. And as I look out, if I pull my glasses down a little bit, I can see more clearly. I'm pleased to see so many great partners here today. And let me say a special thanks to Belanle and to Access Bank, Belanle for your warm and thoughtful welcome, and to Access for hosting us here today, and personally to add a special thanks for the care that the title for today's forum is Accelerating Investment to Bring Malaria to Zero. And it's true that investment is sorely needed. Funding for malaria is only at 41% of the 2020 target of $6.5 billion. And as you've heard, and we will continue to reinforce through today's session, almost half of the world's population is at risk of contracting malaria, and the disease remains a major public health challenge, especially here in Africa, which bears 90% of the global share of malaria cases and 91% of malaria deaths. We want to change that. Nigeria accounts for the highest number of cases and deaths from malaria in sub-Saharan Africa, and the economy itself loses approximately $1.1 billion each year due to malaria-related absenteeism in the workplace and treatment costs.
Thank you, Chooks. So good morning, everybody. Standing on all observing protocols, I still have to say hello to the Honorable Minister. For all protocols observed for everybody else, please forgive me. When I think about what it took for, say, Italy to overcome malaria, or the US, right? These aren't places that we think of as malaria infested anymore, but they had it. And what it took was a combination of policy, the government, the private sector, civil society, the medical community, and citizens coming together and working together to end malaria, and they were able to do it. I read this book about how Italy was able to overcome malaria. And so it gives me hope that we can do the same thing. At the Aliko Dangote Foundation, we have been focused on malaria for quite a few years. Alhaji Aliko is the UN Malaria Ambassador for Nigeria. And what that means is that he's supposed to use his voice, his resources, and his time to help us move towards the end of malaria.
So, this is the remark of the National Coordinator, National Malaria Elimination Program, Dr. Audu Bala Mohammed, on state of malaria in Nigeria, challenges, opportunities to engage private sector at a forum organized by the Corporate Alliance on Malaria in Africa, CAMA. Malaria constitutes a huge epidemiologic burden in Africa and continues to cripple economic activities in the region. In Nigeria, the disease is responsible for 60% of outpatient visits, 25% of death in children under 1 year, then 11% of maternal death, and 30% of childhood death. The financial loss due to malaria annually is estimated to about 132 billion naira in terms of prevention, treatment costs, loss of man-hours. The National Malaria Elimination Program is domiciled in the National Malaria and Vector Control Division, which is a division in the Department of Public Health or the Federal Ministry of Health. As a national program, it comprises of malaria control activities at federal, state, local government, and community levels. The private health sector accounts for at least a third of 34,000 health facilities in the country.
The Global Fund to fight HIV/AIDS, TB, and malaria, and business leadership convened by our organization, GBC Health, and others. We have reduced mortality from malaria by more than 50% worldwide. This effort has prevented millions of premature deaths, untold human suffering, and saved precious resources in countries heavily affected by malaria. Children have been able to develop their full potential, and mothers have had to spend less time at clinics and more time in productively participating in their societies.
Called on ExxonMobil, Dr. Adekunle, to share with us what are some of the challenges to fostering public-private partnership in Nigeria. Many times we are already on a forum. People talked about public-private partnership. Is there a framework you can share that you think can work for us to be able to help at local level, at national level, at regional level, especially for the malaria fight? ExxonMobil is doing a lot of great work in supporting non-governmental organizations, civil society organizations, and private sector to boost the malaria fight. What can you share with us about partnership framework or what we need to do to foster PPP in Nigeria?
Yeah, thank you, Dr. Arolo. Standing on existing protocols. The first thing we're talking about, the challenges to fostering PPPs in Nigeria. I think as a Nigerian, you know that the first issue we have, the first challenge we have is distrust. We have a history, things have happened in the past, and when private organizations come into programs, they are very careful.
I want to give the also opportunity of asking him questions. We've listened to his keynote address, and I know we are burning to ask one or two questions from him. So one, can I have one more? Okay, two, great. Yes.
My name is Dr. Akinfa Jola. I'm Regional Community Health Manager for Shell Nigeria, and I'm excited to be here today. I'm really excited about the diverse team that is in the house, and excited that our Honorable Minister is also here. I listened to him attentively, and really excited about the stepwise approach in which he highlighted a lot of things that the government is looking at, and the supportive collaboration from the private sector. Once again, I don't know whether this is actually a question to the minister, but I think it's just food for thought for all of us. Because Dr. Adekule mentioned some principal things that are very essential for us if we really want to deal with the malaria battle. And the minister asked us that, are we really ready to beat malaria? I think for us, Dr. Adekule highlighted a few things, and I just want to piggyback on a few things that he had highlighted, and for the minister to take some of these things for us to be able to work together. One, I think the private sector needs to bring together its complementary strengths. We have different strengths, and we can.
Thank you very much. Let me start with the last speaker. I did say that I like the idea of the group that was presenting an integrated approach by adding nutrition. You'll notice that in the chart they showed us, the highest prevalence of malaria was in the northeast and northwest. And that's where we also have the highest prevalence of malnutrition. So, is it coincidence? So we don't know. But then, of course, those areas are different because the Sahel area, the 9 states we have in the north, which have seasonal malaria, because during the dry season, they don't have malaria at all. So they have very low residual immunity. And when the rainy season comes, they get malaria. It's usually much worse than you see in the south. So they have a lot more terrible cases. So, yes, the strategy to improve nutrition cuts across everything, including all diseases, whether it's tuberculosis or whatever.
And tag the Corporate Action on Malaria Best Practices and Guidance. For the past decade, the Corporate Alliance on Malaria in Africa has mobilized business action on malaria, recognizing that the assets of the private sector are a valuable resource in the fight to protect employees, communities, and consumers from malaria. Today, CAMA members are leading. You can see what they're doing. The video tells it all. They're showcasing what they're doing, and they're actually at the forefront of the fight against malaria. So at the end of the event, we're going to share with everybody in the room. Thank you all. And
the opportunities, the challenges, and the lessons learned, especially from your own implementation in Nigerian breweries.
Thank you, Dr. Arolo. Okay, so Nigerian Breweries Workplace Malaria Program started about 2003, actually, as part of the rollback malaria program. Obviously, we were having there was high prevalence of malaria amongst our employee, and that resulted to affecting our productivity. So it was quite easy to get the buy-in of the management to get really serious about it. So that started pretty well, and we got the buy-in. And obviously, we need to start with awareness provision and educating our people on what we're trying to do.
Thank you so much, Dr. Oyewale. Before I conclude and wrap up this plenary discussion, I may want to ask one or two contributions from the audience, either question, contribution, or input. 1, 2, and 3. Yes, I'll take you first, sir.
I'm Johnson, Fabrice Johnson Olushetire, Managing Director of All Farm Nigeria Limited. All protocols duly observed. It's just a contribution towards the nutrition part of the minister's speech. I'm happy because one of the directors of Federal Ministry of Health is here, and a colleague too. During the September last year United Nations General Assembly meeting, I was opportune to be in the United Nations Health Council meeting for new innovations in New York. And a lot of presentations were made.